Let me welcome our final high-level speaker for today, who is here in presence, and we also have a contribution, recorded contribution. Welcome.
Thank you very much.
So let me welcome Manuela Tomei to the podium. She is the Assistant Director General for Governance, Rights and Dialogue, all very apt given today's conversations and discussions for the ILO, of course. And we will also have a pre-recorded contribution from Bruce Aylward, who is the Assistant Director General of the Universal Health Coverage in the Life Course Division at the World Health Organization. Without further ado, I will hand over to Mrs. Tomei for her contributions.
Thank you very much, and good afternoon, everyone. I was told that you have had a very rich, very engaging discussion throughout the day. I'm also very happy to see some former ILO colleagues sitting here in front of me. Welcome, and thanks for your contribution. I know that it's late, that you have been talking and discussing the whole morning and afternoon. Therefore, I will try to be as short as possible to enable you to leave and to perhaps have a good glass of wine. I don't know whether that is politically correct, but I think that's health-wise. But I think it's a good booster.
With moderation.
With moderation, exactly. So I would just like to make a few points that I think reiterate or resonate a bit with what you have been saying throughout the day, and which is also based on my personal experience and lessons that I have been learning throughout the years. So colleagues, of course, health, I don't need to say it to you, but health is a fundamental human right, a pillar of social justice, which is what the ILO stands for. And universal access to quality health services is essential for individuals to pursue education, to work, to thrive in life. At the same time, whether people have a job, what are the conditions of that job, how much they make thanks to the job, and whether they are protected and covered by social protection makes a significant difference, not only for their income security, but for health outcomes. And I think this really reiterates and confirms the absolute necessity of looking at access to universal health coverage and universal social protection together. And this togetherness is even more relevant when we are considering and looking at the informal economy and the many challenges it raises. And this brings me to another point, which is that the quality of health services is very much dependent also on the quality of work of those who provide those care services. So quality of work is synonymous with quality of health services. Of course, we need more than quality work, but this is an essential factor. And yet we have heard that healthcare workers are very often, well, first of all, they comprise mainly women, with a few exceptions across the world. Of course, that is a reflection of also cultural norms. But they are predominantly women. They often endure very low pay, if any. They endure very poor working conditions, very limited, if any, prospects for developing further skills for professionalization. And this is definitely having implications for the quality of health services. I would say also that in the case of healthcare, who are workers, who are women, they are also facing time hungry. They are time hungry, right? Because they are not only expected to perform paid work, but at the same time, they have also to provide unpaid care work to their families and communities. And this, again, has very important implications for their health, including their mental health, because of the combined pressure. And by the way, informal workers are more likely than their formal peers to be exposed to unsafe and unhealthy working environments, including higher risk of exposure to violence and harassment, which is related to work, including gender-based violence and harassment. And this, again, increases the likelihood of informal workers to injure themselves, to fall sick, to die at work to a larger extent than formal workers. So to create a more resilient, equitable, and fairer future for all, we must join forces. The ILO's international labor standards are certainly the cornerstone of these efforts. We have standards that provide very clear guidance in terms of how to promote decent work for all workers, how to extend social protection, how to ensure that workers, including in the formal economy, enjoy the fundamental principles and rights at work. And without any doubt, gender-responsive approaches need to be at the heart of strategies and policies that are aimed at ensuring universal health coverage as well as universal social protection coverage. And this for two reasons, not only because healthcare workers are predominantly women, but also when we are talking and looking at where women are placed in the informal economy, they are concentrated and disproportionately represented in the most vulnerable segments of informal labor markets. They are very often unpaid family laborers. They work as domestic workers or healthcare workers on a voluntary basis very often. So, you know, this really makes very relevant a gender-responsive approach. And in a world which is subject to recurrent crises, collaboration across employment, social protection, and health sector is absolutely critical if we do not want to leave anyone behind. I have just heard earlier on about, I think you were talking about also migrant workers or so it's the whole issue of also, you know, people are under a lot of pressure in terms of moving within countries or crossing borders because of climate change, the impact of climate change, because of wars, because they are fleeing also poverty or simply looking for better life opportunities. And them, as well as you know, women in precarious employment are also exposed to discrimination. And discrimination and intersecting discrimination, conflating forms of discrimination are another important source of vulnerability to health conditions. And this again calls for greater emphasis and working together to increase synergy and coordination across policies and services. So I don't want to absorb more of your time, but just to say that I would be very interested in learning more from colleagues, from my colleagues, about the main takeaways of this event, and also what will be the next steps. Already, you know, getting together and realizing that universal health coverage and universal social protection coverage go hand in hand is, I think, a major step further. But of course, we would need to move beyond realizing this and engaging in some more joint practical steps. So thank you very much.
Thank you so much to Ms. Tomei for so eloquently, I think, summing up everything that was discussed today, the key topics, the challenges and the opportunities, the pressure points, with a strong focus on gender equality, of course, and also the priorities that lie ahead, particularly with regards to collaboration, which of course was one of the buzzwords that we mentioned over and over today. So thank you so much. We will now be showing the final video message from Bruce Aylward, and thank you to my colleagues for helping out.
Manuela Tomei, our Assistant Director General at ILO, distinguished colleagues. With just over 5 years left until we reach 2030, the world is not on track to meet the health-related SDGs. 4.5 billion people still cannot access the essential healthcare services they need, and 2 billion people face financial hardship because of out-of-pocket health expenditures. Today, we heard how important social protection measures are to ensuring access to essential services where they are most needed. We also heard that the integration of such services with health services is at the core of meeting the needs of communities. To provide quality health and social services, we need a well-supported, trained, and motivated health and care workforce. This is a cornerstone for improving health and well-being for all. However, many of our health and care workers are engaged in insecure and precarious employment, which undermines the quality and the delivery of services. Unpaid care work, low wages, and poor working conditions mask the true cost of care, for which the burden often falls on women. It's sobering to note that 67% of unpaid care is delivered by women, 2 in 3 of our health care workers. As we've heard, urgent action is needed to address these issues by extending social protection to informal and volunteer health and care workers to help formalize their roles and contributions to health for all. It's time to work together to find solutions. Together, WHO and ILO have consistently promoted equal rights, equal work, and equal pay for women health and care workers, and decent work and social justice for the entire health workforce. Today, on UHC Day, we have an opportunity to call for a fair share for our health and care workers and to align our efforts around a common universal health and social protection agenda that will ensure better health outcomes, well-being, equity, and the economic empowerment of women. Thank you.
We are changing our lineup just to keep it fresh, make sure that everybody's still with us and they realize that Mathilde is not me and I am not Mathilde.